Hello, guys. Today is Friday, September 18th, and welcome once again to my Facebook Live on COVID 19 and coping with COVID. As you know, my name is Dr. Shelley Coleman Glover. I am a board certified gynecologist specializing in anti aging, hormone balancing, and wellness. My office is located in Clermont, Florida, which is a suburb of Orlando, Florida. Which is part of what we call Central Florida. And we've been coming together every week discussing all things COVID to kind of give you an update, help you to be able to let go and focus in your new norm during the week and kind of catch up on all of the COVID data that I've been able to scrounge up over the week for you to help you decrease your stress levels, hopefully. So, what is the latest? First of all, let's look at our numbers as we always do. And worldwide, unfortunately, hi Karen, we are over 30 million cases. We have 948,000 deaths. So that means there were almost, and this is worldwide, we're almost at 1 million people dead from this pandemic. As of now, and unfortunately, I do believe that by next week, given the way the numbers are going, we will have passed the 1 million mark of people dead, which is just horrific. Now, thank goodness, we have well over 20 million people that have survived, and obviously that is a very good thing as well. In the U.S., we're up to 6.7 million cases. That's up from 6.5 million last week, and we have 198,000 deaths. So once again, we're about to hit the 200,000 mark, and these are not marks that we want to miss. And remember, these are people. This, we kind of, like I said, talked about last week, getting desensitized to these numbers. These are human beings that are dying, so we need to be really aware of that. And unfortunately, could end up being one of us and/or one of our loved ones. So we need to take it seriously. We do have 3.52 million people that have survived in the U.S., which again is a blessing. In Florida, I always give the Florida data. We have 677,000, almost 678,000 deaths. Excuse me, cases. That would not be good. And 13.2 thousand deaths, up from 12.7 thousand last week. And within Florida, we did pass some good milestones for us. We only had 2 deaths in the state of Florida yesterday. That's amazing. We had a huge surge last week, and that may have been with some data releasing. It may have been from the Labor Day holiday, not sure, or just some people that unfortunately just, it was just a very bad week for us, which adjusted our total numbers. But this is amazing compared to where we were in early May, where we were having over 60 deaths a day. The median age is still about age 40. The new cases, 3,239 as of yesterday, and that is a drop for us. This is the first time that we have been as low as we are with our positive rate of testing. So that means out of the people testing, out of the people getting tested, how many are testing positive? And we in the state of Florida are down to 4.1%. And that was as of yesterday. Last week was 5.2, which we were, happy. The goal is actually to be under 5. Obviously the goal is to be as low as possible, but definitely under 5 is exciting. And to be under 4, to be at 4, almost under 4, is really, really exciting. Our overall rate is still kind of hanging there at 13.4%. It hasn't really budged that much. It was at 13.5, so we've gone like itty bitty bit, but we'll take everything that we can get, and like I said, so we've been extremely high, and we appear to be heading in the right direction, so hopefully we can keep it that way. One of the reasons why this is actually really good data, because we are now 2-week status post Labor Day, and unlike Memorial Day and 4th of July, where we actually saw a significant pike up in our numbers and our deaths after those holidays. It appears that we actually did okay for Labor Day here in Florida. So very, very exciting news, and we're happy to see that. The Lake County, which is where my office is located, my office is in Claremont, Florida, which is in Lake County. They have 7.2 thousand cases, up from 6.9 last week. 529 hospitalized overall throughout the pandemic, and 169 deaths. Now that is, we did lose 29 more people this week in Lake County overall, so that's some high numbers. The median age is 43, whereas the rest of the state it's 40, so not much higher, but we are an older population in Lake County and a smaller county. I told you I started watching the kid data, and for the 15 to 24 age group, the children that we had, we're now at 1072, up from 1,000. So a little bit of a pike in that 5 to 14 age group for Lake County, whereas the 25 to 34 in Lake County actually held steady, so that's a good thing. Not that we want to see our young ones getting testing positive either, of course. The Orange County, which is our neighboring county and is much larger, is at 38.2 thousand cases, up from 37.2, so basically 1,000 more cases in the last week. They have 1.3 thousand hospitalized throughout the whole time, and 431 deaths, so up about same thing, about 26 deaths. So the median age there is still holding at about 36. The kids have, in the 15 to 24 age group, went up to 6.9 thousand, up from 6.7 if you round it up, so about 200 more kids in that age group, and 8.9 thousand from 8.7 thousand in the 25 to 34 age group. So did see an increase in that age group in Orange County, whereas we really didn't see that as much in Lake County. One of the main hospital systems, Orlando Regional here in Central Florida, is showing really good data still. The number of cases down 80% compared to the height of the pandemic for Florida, and only 76 patients actually in-house, and only 9 in the ICU downtown, which is our main hospital. So we're seeing some good numbers there, which is exciting. New data in Florida, as I mentioned last week, our bars reopened 50% capacity last week. Haven't really heard too much, haven't seen anything yet, so stay tuned. Let's see what happens over the next week or so. Same thing, remember, when there's a big change in things, you're going to see that number kind of kicking in about 2 weeks later versus within a couple of days. So we will see the effects of our latest expansion of reopening next week. So let's look at our data then and see, and hopefully we see some good results with that. The Central Florida, the fall sports started to return. We did have one of the football teams locally had 5 team members test positive, and so the entire football team and coaching staff was quarantined, and the football games were canceled this week in Orange County because of that. So we shall see what happens. My daughter's high school has now had 2 cases test positive with quarantines of surrounding people. They have not changed. They have not closed down as of yet. They've just quarantined those that were exposed. The new across the world, as you already know, the United States, India, and Brazil make up over half of the cases of COVID-19 throughout the world. So this is, once again, not a club that we would like to be in, but we are in this club. India is actually seeing a significant spike in their numbers over the last week, and they were seeing a spike last week, so let's say over the last 2 weeks they're seeing quite a bit of a spike. And the World Health Organization has said that over half of all the countries in Europe have seen at least a 10% increase in their COVID-19 cases, and there's 7 countries that have a tenfold increase. So we're definitely seeing that there is a big rise in numbers. France is back up to the point where their ICU capacity is starting to become questionable. So this is what we don't want. Remember that whole thing way back when about flattening the curve to keep the ICUs and the hospitals from being overwhelmed. So we do not want to go backwards here and see this stuff starting to occur. And that's what seems to be happening in some of the countries in Europe. And so we need to take heed, learn from other people's mistakes, and we don't need to all make the same mistakes. That doesn't make sense. We're all big kids, right? So that is definitely concerning. Israel. So a lot of the states are actually thinking about, they're actually going backwards on their reopening stances based on what's going on. Israel was about, there's some holidays coming, and they actually did impose their restrictions very heavily because of a marked increase in cases over the last 2 weeks. So we shall see how that pans out. Of interest, Russia, we know, had approved a vaccine without going through what we call phase 3 trials, which is where we test a medicine or vaccine in large populations. Well, they have now also approved a medication called Coronavir, which is what we call an antiviral medication, and it is, according to them, used to treat mild to moderate cases. They say that it was in a phase 3 trial, but there were only 168 people in that trial. As we discussed last week, phase 3 trials, the whole point of phase 3 trials, so that's really more like a phase 2 trial. Phase 3 trials are supposed to involve large numbers of people so that you can be sure that, how the public is going to respond to it. So it's supposed to involve large numbers, usually in the multiple thousands. Like we're usually talking about 30 to 60,000 people, not 168. So what they're calling phase 3 trials is not what we call phase 3 trials here in the United States. So that medicine has been released. We shall keep an eye on that and see what transpires with that. On our front, we are seeing that Eli Lilly has just released a preliminary research. It's just a preliminary, but they are seeing hope for a new drug that is what we call a monoclonal, let me say that correctly, a monoclonal antibody. And what it is it's a man-made antibody made from the antibodies of someone that has had coronavirus. So that's taking us back, like you've heard us talking about the convalescent plasma from people that have already had coronavirus, and once again it's trying to boost up, take that immunity property and transmit it over to someone that needs it. And what they're showing on their preliminary data, they had 302 people in the study, and so to put things in perspective, that's more than Russia's phase 3 trial, and this is not even in that they've released. So what they did see is that they had about a 1.7% hospitalization rate in patients that were on the this new medication, compared to a 6% hospitalization rate in patients that weren't. So that's pretty impressive. They also saw that there was a decrease in the amount of what we call viral load. So how much how much of the virus is excuse me guys, I'm gonna sneeze. Excuse me. How much of the virus is how high the virus load is in your body. And so they see that it's actually decreasing the viral load and also decreasing the amount of hospitalization. So that's really exciting. We want to stay tuned. We want to get more information, because this is great. This is what we want, is to find treatments that are safe and are effective. So stay tuned, and we'll get you more information as that unfolds. Other things, Astrazeneca was the pharmaceutical company that halted their phase 3 trial of the vaccine last week because of concerns over a patient who had a serious illness develop during that. The patient has subsequently recovered from that, and they're not sure, once again, whether or not it's from the vaccine or not. And so, but they did halt the trials while they were evaluating it, and they have now resumed the trials. And that patient is actually doing better. So, like I said, there are boards that are watching all of this stuff. That's the whole point of the phase 3 trials, is to see what's happening and to observe it objectively, to make sure that whatever it is, whether it's medicine or vaccination, that not only is it effective for everyone, but it's also safe. So the trials continue. Of note, there are some new studies out, just polls, excuse me, not studies. There are some polls out, and the faith in the vaccinations and people that are willing to get them has plummeted significantly since they had done the polls, I believe, in May. Don't hold me. It was definitely early summer or May, and that seems to be in those that are being polled. It was due to the perception that the vaccines are being rushed to delivery, and the fear that there was going to be a vaccine released as early as October. As we discussed last week, the likelihood of that is pretty much like, yeah. So relax, don't stress, please don't even think about whether you're going to get the vaccine right now. Just let go. Let's let the data flow. Keep your mind open. That's the key thing. Keep your mind open and pay attention to reliable data. Just because somebody posted on Facebook or on Twitter or any of these things, or anywhere on social media, it doesn't mean that it's gospel. And please, once again, I haven't seen too many of these lately, but the friend of the friend of the friend that works for John Hopkins, that's all. Let's not go there, okay? So please keep your mind open. That's what I ask about the vaccinations. You have to be open-minded right now, and let's let things take its course. Be aware that even if whenever the vaccinations are available, which we are anticipating on a large scale, will be at the earliest at December, January, probably more like January to March time frame. But even once they're available, they're not going to have enough for a large people to be vaccinated for a long time. So just be aware of that. It's not gonna be, as we've heard, where everybody's lining up and getting a vaccination, because there's not gonna be enough of them for that to happen. So once again, it is flu season. Flu vaccinations are recommended. We talked about that. Please get your vaccine. Not only are you protecting yourself against the flu, which is deadly, you're helping our hospitals remain open so that everyone has access to hospital beds. Flu patients do take up a significant amount of hospital beds, and we do not need that, because if we have this uptake of coronaviruses as well as flu viruses, then our hospitals can become strained and our ICUs can become strained, and that's once again when we start seeing our death counts go up, when people cannot get the care that they need. So we don't need that. We need your help. People always want to, that was one of the things we talked about last week, that after September 11th, after 9/11, people were very much united, and we wanted to work together and see what we could do to help. Well, these are the kind of things we can do to help by working to protect our fellow Americans, by getting flu vaccines, by practicing our physical distancing, by wearing the little mask, whether you think it's a good idea or not, and by doing these simple things, washing your hands, which shouldn't be something out of the ordinary there, and that's how we work together to try to make all of us healthy, and hopefully all of us coronavirus survivors. So what else? The latest, there was another study out that looked at people who got diagnosed with COVID compared to those that didn't. And one of the things that they found, that the increased risk of testing positive, that one of the factors that fell out of that was eating out, and that the people that were testing positive were more likely over the weeks prior to have eaten out at restaurants more frequently. Now, they did not delineate between eating indoors or outdoors. And we do know that obviously indoors with recycled air is going to be hi Valerie, is going to be a much higher risk than it is going to be outdoors. And it also depends on, what's going on in that environment that you're in. Is the restaurant, and even more importantly, it's not usually the restaurant, but are the people in the restaurant, the patrons, doing what they're supposed to be doing? We actually went out and we were sitting outside, and the tables were correct. The wait staff had on their mask, but there were definitely people that, obviously you have to take your mask off when you're eating, but there were definitely people walking in and out of the area who did not have their mask on. And so, I think that we have to realize that reopen once again, if we all practice what the new norm is, then we're going to get much further than if we are trying to ignore that there's a pandemic out there and just assume that we're going to be one of the lucky ones and we're either not going to get it, and or that we are going to be one of the lucky ones that gets it and doesn't have any side effects, any significant symptoms. I would love for that to be the case. I would hope you never get it, and if you get it, I hope that you never get any side effects, but you don't know that. So please protect yourself, because hindsight's 2020. Yep, and Valerie, if you guys can't read it, Valerie said that she tested positive for COVID in July, and she's pretty sure that she got it from being in a restaurant. So definitely, you just have to realize that, oh my God, the liquor. Just watch it, guys. So that's my only fear with the bars. And I can tell you, I know one of my clients, and they own a bar, and he was very clear. He said, yes, I can definitely understand the risk that goes with it. You guys think about it. When you're in a bar, what are you doing? I don't know how bartenders hear anything anyway. I'd be the worst bartender in the world, because I'm just not that good. But I guess they do have to do some level of lip reading. But they do. What are they doing? They're leaning across the bar. They're yelling at you because the music's loud. You're drinking, and they're yelling at you to try to ask you what you want, and you're yelling back at them because they can't hear you to clarify what drink you want. It is, if either person has it, and plus everybody around is also being exposed. So you just have to realize that, and so same thing whether you're so it's just a higher risk. And also because once you're drinking, think about what happens. You do get more relaxed, and what's 6 feet, when you've had a drink or two, 6 feet kind of gets a little bit closer, and so you get more chatty, you get more loose in your stuff. So hi Eileen, and I haven't forgotten about you, Eileen. So I got to get ready for this thing on Friday, so I got you. But so just be aware of it. I understand everything about the economy. As you know, I am a small business owner. I get it, but we also have to be aware, and you have to realize, just like, let's put things in perspective. Let's put it in something that you can think about. So for if you're trying to, smokers know that they can't drink. Because if they drink, then they're going to tend to relax and let go, and they're going to start smoking, because once again their defenses are down, they're relaxed, and you kind of forget all the things that you're supposed to be doing. And that's obviously, I'm talking about if you're getting to the point, if you've had that much liquor on board. And you don't have to be a sloshy drunk, but you know what I'm saying. So the same thing, if you could say that you're not going to eat X, Y, and Z. If you have enough drinks, you will actually, if there's food around, people tend to start munching. So it's the same kind of thing. You just alcohol unfortunately kind of lets down the normal, it kind of dulls our sense of what we're supposed to be doing and what we're not supposed to be doing. So just be aware of that. And that's why there's a big concern with the bars. But as long as there are numbers, if people can practice responsibly and can do it, hey, great, more power to them. And I think that they're definitely the bars are trying to stay open, so they're going to definitely be doing their part to try to make this situation as safe as possible. I have not been into a bar, so I can't tell you what's going on there. I've only been into bars that are within the restaurants, but I can tell you they're definitely have cut down. They've taken out the seating. They've got the seating only like a couple of bar stools here and there around the bar, 6 feet apart. So they're, like I said, doing their darndest to try to get themselves to stay open. The other thing that I wanted to just brush on, and the other thing that we can look at is the hotspots. Where are the hotspots? So the hotspots internationally are coming out with the soccer and the rugby and stuff. With the fans, etc., they're starting to see that those are hotspots. So we'll stay tuned and see how that works. As far as closing out the fans, etc. Because of that, within the U.S., we're seeing our hotspots, lo and behold, are in the university towns. And so we're seeing the counties where the colleges are, that the incidence of COVID is, let me not tell you the wrong number. I think it's 3 times higher than, like, percentage-wise for that county than the whole states that these universities are in. And they do believe that it's off-campus partying. So be aware of it, and it just goes to, it's just that whole vicious cycle from the very beginning, and that our kids just, a lot of them are not taking it seriously. So if you are one of those persons, you have to, I don't know what to tell you besides all the stuff that we've already said. If you're a parent, you really need to take the time to talk to your kids and try to help them to understand. Now, one thing I did want to touch on, the other thing two things I wanted to touch base with you guys on, and then I'll let you go, unless you have some other things that you'd like to talk about. So you know that there was supposedly the CDC came out with this recommendation out of the blue that blew most of us away, that said suddenly you don't have to test. If you've been around somebody, if you've been exposed to somebody that you know is COVID-19 positive, but if you're not having any symptoms, okay, you don't have to go get tested. Whereas before, it was, if you've been exposed to someone that has coronavirus for more than 15 minutes, that if there's been a significant exposure, whether you're symptomatic or not, you should be tested. And that is what the medical community has been saying all along. And then suddenly, out of the blue, the CDC came out with this, and it really kind of threw us all for a loop, and we're kind of like, what the heck is going on? Well, that has been reversed back, and the CDC has now said that really did not come from the scientists at the CDC. It actually came up higher from the Department of Health and Human Services and the White House Task Force, and so that was not, but it was kind of posted on the CDC website, but that was not something that the scientists and physicians at the CDC were recommending at that time. And like I said, that has been recanted, and they are going back to they have now posted their original recommendations. So that's all I'm going to say about that, but do be aware of that, and the recommendation is to get tested if you feel like you have been in a situation, because we do not want to get this spread. Other things we've heard of, parents knowing that their kids are COVID positive and sending their kids to school anyway. Do not do that. Just don't do that. It's not good, people. Don't do it. This is not, we're not having chickenpox parties or anything like that. This is a very deadly disease. We do not. You please do your part. That's all I can say is you got to do your part, and don't, if you choose to not believe that COVID is something that you need to be concerned about, that's fine. But if your child is positive, then obviously that you should be taking heed, because there's probably other people in your house that are positive as well. But we do not need to then infect other people and create havoc within the school systems, because it really does, and it makes it harder for us to be able to, those parents that want to send their kids back, it makes it harder because they're watching all of this stuff, and the more their cases, the more things get shut down and get disrupted. It's just costing our taxpayers, so it's your money too, more money as the schools are scrambling to try to deal with all of these situations. So Florida, Central Florida is, Orlando is on Orange County is on their, today was actually the last day to decide whether or not the second 9 weeks of the school system will be on what we call launch ed, which is where the kids are studying from home, and or if the kids were going to go back to brick and mortar. Once again, our third option, which has been virtual, that for the whole year was already, those kids are already being what they call homeschooled, and they're in their own, they're already a go. But there was an option to potentially send the kids back to brick and mortar. My daughter's staying home for now. And I will say, for those of you who have not, who may be concerned about your kids being home on launch ed because of all the interesting teaching things that were going on back in the spring, it is much better now. It's a completely different situation as far as here in Central Florida for the homeschool, the launch ed situation. So if that was a big concern because of that, I think that that's something you might want to be aware of, that we are actually doing pretty well with it. And that's not to say across the board for everyone. There's certainly challenges with launch ed as far as internet access, as far as computers working correctly, and so there are glitches, but overall it's way smoother than it was in the spring when it was really quite interesting. So the last thing, which is kind of what we're already talking about, is this whole thing they're calling it pandemic fatigue, which means I'm sick of it. I'm just sick of it. I'm sick of hearing about it. I'm sick of wearing a mask. I'm sick of not being able to do what I want to do, so I'm just going to say screw it. We can't do that. We just can't do that. That's what we're seeing. We're seeing that overseas, and we're seeing their numbers go up exponentially. And once again, it's not just their numbers going up, because of course there's everybody saying, well, who cares if you're positive if you're not having symptoms? The admission to the hospitals is going up, and the admissions to the ICUs are going up. So that's what you need to pay attention to. It's not just a benign disease. And when it's your family, when it's your loved one, or heaven forbid if it's you, then it's a whole different situation. And there's just no reason why we need to go backwards. I'm always into learning from our mistakes. So let's try to do that, people. So that's all I have for today. I think this is the first time I'm actually going to finish closer to my 30-minute mark. So hopefully you guys found that informative. And as always, I hope you have a wonderful weekend. If you haven't already done whatever it is you're supposed to do, subscribe, follow, do whatever, please do. I would love to have you. And just so you know, I had some technical glitches last week as far as getting the talk up on YouTube, but I'm going to get both this one and last week's up onto YouTube today, God willing. So as always, I wish you good health. Please stay safe and have a wonderful weekend. Take care.